Antenatal booking is defined as the initial healthcare appointment that a pregnant woman has with a healthcare provider to initiate her prenatal care. The activities carried out at the antenatal clinic are registration and booking, history taking, physical examination, investigation and tests, medications, advice and IEC, and recording. Now, let us look at each activity starting with registration and booking. So, under registration and booking, when the woman reports for her antenatal care booking, she has to be registered for the purpose of record keeping and documentation. After registration and booking, you need to take history. So under history, you need to prepare the necessary equipment, greet the woman respectively and introduce yourself, offer the woman a seat and ensure privacy, explain the procedure and encourage her to ask questions. Get her permission before you begin the procedure. Listen to what the woman has to say. So, history taking is cardinal during an antenatal booking for a nurse or midwife to get to know the client well. It is a means of assessing the health of the woman to find out any condition that may affect childbearing. The history has to be comprehensive. So the key issues to consider during history taking includes social history. Under social history, this is where you get the name of the client, the age, the marital status, religion, residential address, occupation, and education level for self and the spouse. You also need to take note of the social habits and the environmental factors. So this history is taken to identify rationale for follow-up and health education. Women less than 18 years or greater than 35 years of age are considered high-risk mothers. Ask how she is feeling and respond to any danger signs if present. After social history, you need to look at family history. So under family history, this one it is taken to identify any genetic predisposition to certain diseases. Ask the woman if there is any history of the following in the family: diabetes mellitus, hypertension, asthma, epilepsy, sickle cell disease, and mental illness. The reason you're asking for this is because this this history is cardinal because it tends to run in families. So include history of pulmonary tuberculosis contact and history of multiple pregnancies. After family history, you need to look at the personal medical history. Ask the woman if she has ever suffered from any medical condition. For example, those conditions that we are just from mentioning under family history. And then in addition to those, ask about history of sexually transmitted infections, urinary tract infections, hepatitis, and so on. You also need to find out if there is any previous illnesses which may have damaged certain structures or organs, which could give rise to complications during pregnancy and labor. After personal medical history, you need to look at the surgical history. Under surgical history, ask the woman whether she has had any injuries or operations involving the pelvic bones, spine, or lower limbs. This could alter the pelvic diameters and angle of inclination that may lead to cephalopelvic disproportion. Remember to ask about history of blood transfusion to exclude isoimmunization if the woman is rhesus negative. After surgical history, you need to look at the past obstetric history. So on this one, you need to ask the woman about the record of previous pregnancies and labor, whether previous labor was premature or post-mature, spontaneous or induced, history of instrumental deliveries, previous obstetric complications, and previous babies. When you're done with obstetric history, you need to look at the menstrual and contraceptive history. So ask about age at menarche, menstrual interval, and bleeding patterns. Ask about the method of contraception, when she started using it, how long she has used it for, and the reasons for stopping. Then you can also look at the present obstetric history. So you need to ask the woman about the first day of the last normal menstrual period, and then calculate the gestational age of the pregnancy and expected date of delivery. Ask the woman about health and other concerns during pregnancy, such as fatigue, drowsiness, headache, sore tongue, loss of appetite, nausea, and vomiting, as well as edema. Ask the woman the following questions about her dietary intake. You need to ask her what type of food she eats, how many times a day, and any ingestion of non-food items. You also need to ask the woman about the social support and record her responses. So on this one, you need to look at the main support persons, for example, the husband, father, or mother, then the availability of money for food, transportation, and baby supplies. Okay, so this is what you need to look at when it comes to history taking. So key things, first of all, you need to prepare everything. Then you need to start looking at the social history, the family history, the personal medical history, the surgical history, the past obstetric history, the menstrual and contraceptive history, and then lastly the present obstetric history. A physical examination follows history taking and should be done under strict privacy. Explain to the woman what will happen during the physical examination and encourage her to ask questions. Listen to what the woman has to say prior to the physical examination. As a nurse, you need to take note of the following: the stature. So, under the stature, take note of the gait. So, as a woman walks in, observe any deformity, stunted growth, limp, etc., as they may indicate disproportion in the pelvic diameters. A pregnant woman tilting backwards with a large abdomen may be a sign of multiple pregnancy or a very large fetus. Also take note of the height. So a pregnant woman with a height of 150 centimeters or less needs special care. Weight also should be taken note of. So the average weight gain during pregnancy is about 12 to 14 kg. In the first trimester, a woman should gain 0.4 kg per month, and in the second and third trimester, she should gain 0.4 kg per week. Also take note of the blood pressure, temperature, pulse, and respiration, and record these vitals at each visit. After you do that, now you should do the actual examination. So this is done from head to toe. Assist the woman to get onto the couch. Wash your hands thoroughly with soap and water and dry them. Then start the examination. When you start with the head, look for under nourishment of hair and general cleanness. Then you move on to the eyes, examine the conjunctiva for pallor and jaundice. by asking the woman to look up. Then examine the nose to rule out polyps. Examine the ears to rule out polyps and any discharge. Then ask the woman to open the mouth. Check if there are signs of anemia on the lips, mucous membranes of the mouth, gums, and tongue. Check for the fissures on the tongue, oral thrush, and sores on the tongue. Take note of the dental caries, and if present, find out if they are painful. It is important to note that tooth extraction should be avoided during pregnancy due to bleeding tendencies. You also need to palpate for enlargement of the preauricular lymph glands, submandibular lymph glands, as well as the cervical glands around the neck. Palpate the thyroid gland too as well. Ask the woman to swallow while your fingers are lightly placed just below the larynx. Enlargement of the gland suggests infection, chronic illness, or maybe due to effects of estrogen on the glands. Then, when you want to examine the hands, start with the furthest arm. Examine the arms for signs of anemia on the palms and poor venous return on pressure of the nail beds. Then examine for signs of edema. Ask the woman to make a fist with each hand. A feeling of tightness in the knuckles in the absence of pitting edema would be suggestive of occult edema. Check for any physical disability and symmetry of the arms. Lastly, palpate the axilla for any enlarged lymph nodes. Then you need to examine the breast for presumptive signs of pregnancy, that is the Montgomery tubercles, darkening of the primary areola and secondary areola. Then suitably for breastfeeding, this is more significant in prime gravida. Expression of fluid should show, or expression of fluid shows that the ducts are patent. Presence of clear fluid, milky fluid, colostrum are presumptive signs of pregnancy. Lumps or swelling in the breast as well. You need to examine for that when you're examining the breast. Okay. Then you need to move on to the lower limbs. Starting with the furthest leg, examine the legs for any signs of anemia on the soles and poor venous return on pressure of the nail beds. Examine for signs of tibial, pedal, and ankle edema. Check for any physical disability and symmetry of the legs. Also check for varicose veins and calf pains. After you're done with the lower limbs, then examine the abdomen. So you need to do abdominal examination. So you start with inspection. Under inspection, you look for the shape. Okay, so not the contour of the abdomen. Is it round, oval, irregular, or pendulous? Okay, then the size, abdominal size should correspond with the supposed period of gestation. Also examine the skin on the abdomen. Check for a dark line of pigmentation, which is the linea nigra, striae gravidarum, scars, including any operation scars, for example, from a previous cesarean section, and any skin lesions. After you're done with inspection, then you move on to palpation. You're still on the abdomen. So measure the height of the fundus to determine how old the pregnancy is. Perform fundal palpation to determine lie and presentation. Perform lateral palpation to determine the lie attitude and position. Also perform deep pelvic palpation to determine the presentation. Then the last thing that you can do is auscultation. So you need to listen to the fetal heart rate and rhythm, count for 1 complete minute to ascertain regularity. The investigations and tests carried out during antenatal booking includes urinalysis and blood tests. So under urinalysis, you need to ask the woman to pass urine for urinalysis. This should be done at every visit to rule out proteins, glucose, and acetone in urine. For the blood test, you need to collect blood samples for rapid plasma reagin, which is the RPR test. You need to do HIV test. You need to check the rhesus factor, the hemoglobin, and the blood grouping. So, under medication, the following drugs are given to the pregnant woman. Intermittent presumptive treatment. So 3 doses of Fansidar is given at first, second, and third visit to prevent malaria in pregnancy or treat asymptomatic malaria. Fansidar is to be taken by the woman under direct observation by the nurse. Tetanus toxoid injection is to be given up to the 4th dose to prevent adult or neonatal tetanus. The Bendazole 500 mg per oral stat is given for deworming. This is given as a single dose at a minimum gestation age of 20 weeks. Daily doses of ferrous sulfate 200 mg and folic acid 5 mg to prevent and correct iron deficiency anemia and folic acid deficiency anemia. So during antenatal booking, you also need to offer advice and give IEC. So you need to give IEC on the following topics: nutrition and hygiene in pregnancy, the danger signs in pregnancy, minor disorders in pregnancy, birth preparedness and complication readiness, malaria in pregnancy, prevention of parent-to-child transmission of HIV, importance of antenatal care, signs of true labor, family planning, birth registration, and child immunization. These are some of the topics that you can focus on, but there are many more that you can also add. The last part of antenatal booking is recording of findings. So you need to record or enter all the information gathered and the care provided on the antenatal card and the safe motherhood register.